to be doing a basic IV insertion today. I have a doctor's order to do this in case there is a blood transfusion or future surgery. I'm going to go ahead and go through my supplies. I have a piece of tape so I can anchor down my INT tubing, my gloves, my alcohol swab, my INT tubing still in its packaging, 10 milliliters of saline, 10 milliliters of saline, I'm sorry, my 20 gauge needle, and I'll be using 6 milliliters of the saline, not all 10, my Tegaderm, and my tourniquet. So I'm going to go into the room. Hi Mrs. Smith, today we're going to be doing an IV insertion on you. Have you had any mastectomies or shunts on? Well, first I would ask, are you right-handed or left-handed?
Left-handed.
Okay, so we're going to be using your right hand today to do this. Have you had any shunts or mastectomies on the right side?
Nope.
Okay, great. Okay, so now I'm going to pull up a, I'm sorry, I would first, after asking her all those questions, before that I would come in and ask her to state her name, date, and date of birth so I can match it to the bracelet.
Clara Jones, January 20th, 1942.
Okay, it matches the bracelet. Now, then I would ask if she had any surgeries or anything like that. Now that we've had that done, we'll go ahead and move on. I'm going to go ahead and palpate from the distal part of the arm moving up to look for a bouncy and resilient vein. And there's a good one right here. Okay, now I'm going to go ahead and tie my tourniquet about 4 to 6 inches above the insertion site. And when I do this, I'll make sure that I have a, I can pop my tourniquet easily afterwards. Okay, so now I'm going to do hand hygiene. Go ahead and put my gloves on. Before I go back and check my side again and clean it, I will, after doing the tourniquet, I would check for a radial pulse. Okay, and that's good. Alright, so now I'm going to go back to my site and I'm going to clean it from the beginning, in the middle, in a circular motion going out. I'll then get my 20 gauge needle and I would use it bevel up as that's drying. First, I'm sorry, let me backtrack. While that's drying, I'm going to prime my INT tubing with my saline. I'm going to flush it with 3 milliliters of saline. And as I'm doing that, as I'm pushing the saline through, I would clamp it. Okay, and then this would go back into the INT packaging to keep it sterile. Okay, now, since that is done drying, the site is done drying, I'm going to get my needle, bevel up. I'm going to go in at 15 degrees, hold the arm taut, look for a flashback, okay, and then advance my needle. I would pop my tourniquet, hold this down. This would go in the sharps container. I would then grab gauze and clean up the area from blood. And then I would take my INT, connect it. I would unclamp this and go ahead and flush it. 3 milliliters. I would do push stop method. And unhook it. Then I would clamp it before unhooking it, sorry. Grab my Tegaderm, place it over the hub and the insertion site. And then I would date, time, and initial my Tegaderm, and then stick it on this where it was not blocking the insertion site. Then I would unplug this and secure it, also not covering the insertion site. I would then gather all my supplies and throw them in the trash. Again, I would put that in sharps. I would ask my patient, Ms. Jones, how did you handle that procedure?
I'm all right.
Okay. All right. So then I would, like I said, clean all my supplies up. Then I would go and document the time, the date, the size of the catheter, the location, the condition of the location, the number of attempts that it took for me to do the IV insertion, the client's response, and any instructions I may have given her.